Today I will be covering a very important and a little tricky topic, that is portal hypertension. Now, actually, portal hypertension is quite a big topic. So to cover it in one go is a little difficult. So we will do it in two parts. This part is going to cover mainly the etiology, the pathogenesis, why does someone get portal hypertension, its effects, the clinical features, those kind of things. And in the second part, we are going to cover the management. Okay, so all aspects, the clinical aspects, the surgical aspects, anesthesia aspects, medical aspects, it's a overlapping disease and it can occur across all ages. So undoubtedly, it's an important topic and it can be difficult to understand, but I will try to make it very simple for you. All right, so let's get started with portal hypertension. So in the first part, we are going to do the etiopathogenesis, then we will do the clinical features. That this is going to be the first module. And the second module, which will be at a later date, we are going to cover the management, right? So let us try to understand what is portal hypertension. And to understand portal hypertension, the first thing you need to think about is portal hypertension means what? Because normally when we say hypertension, we always talk about hypertension and arteries, right? We always say systemic arterial hypertension or pulmonary arterial hypertension. But portal circulation is not an arterial circulation. Portal circulation is a venous circulation. So when I say portal hypertension, actually I'm talking about portal venous hypertension, right? I'm trying to say portal venous hypertension. Now, what does it mean? How can there be hypertension in the vein? Can there be hypertension in the vein? Of course. Like in lower limb, you have varicose veins. Varicose veins, those are the dilated veins. Those are actually a type of lower limb venous hypertension, right? It is called as ambulatory venous hypertension. So yes, in veins also you can get hypertension, but the basic difference, you should ask yourself, how is portal hypertension or portal venous hypertension different from some arterial like a pulmonary artery hypertension? How are they any different? So one basic logic you need to know. Whenever I say hypertension in an artery, arteries are vessels which have a lot of resistance. So when the blood flow increases in an artery, what does the artery do? It constricts. Its wall becomes thicker. So whenever I say arterial hypertension, it is characterized by vasoconstriction. Right? This is the basic logic. It is characterized by vasoconstriction. But on the other hand, whenever I say a venous hypertension, now veins don't have too much resistance. So when there is too much blood or too much pressure in the vein, there is going to be a venodilation. Okay, there is going to be a venodilation. So whenever we talk about portal venous hypertension, the logic you should think is dilation of portal vein. That is the main message. Portal vein will dilate, its tributaries will dilate, and these tributaries, once they dilate a certain point, when you feel they are going to explode, they don't explode, something else happens in them. Okay, that we will discuss when we do the pathophysiology of the disease. But get this message very clearly that when I say an arterial hypertension, artery is going to undergo a constriction, and venous hypertension, like a portal venous hypertension, the vein is going to dilate. Now, some values we should know when we say portal hypertension, and you need to understand what is portal vein, right? Portal vein means what? Because we are going on and on about portal venous hypertension. Why is it such an important disease and what is portal vein? Your liver gets 60 to 70% of blood flow via the portal vein. So your portal vein is the main vein which supplies the portal blood, which supplies the blood flow to the liver. All right, this portal vein is formed by two main veins. There is going to be splenic vein. So this vein, which is coming from the spleen, there is a superior mesenteric vein, which is coming from the intestines. These two veins come together, they will form the main portal vein. And whenever any vein or artery enters the liver, it splits into two branches. So portal vein will split into left and right branches. They will enter the liver. They are going to split into multiple branches and give 60 to 70% blood supply of the liver. The balance 30% of blood comes from the hepatic artery. So liver also obviously has a hepatic artery, which also goes into left and right branches, but it supplies 30% blood. So the main blood flow of the liver is the portal vein. If for some reason the pressure inside the portal vein increases because of some obstruction distally, so the portal vein has like a traffic jam. Portal vein will get congested, and I told you the vein will dilate. So for me to label as someone having portal hypertension, there should be a portal venous pressure. The portal venous pressure should increase. And how much should it increase? It should be by definition more than 10 millimeters of mercury. So when I say portal hypertension, portal venous pressure should be more than 10 millimeters of mercury. Now, obviously, it's not like measuring your brachial artery pressure, right? How do you measure portal venous pressure? You have to put a catheter in the portal vein. Quite fancy. Who's going to catheterize the portal vein? So there is a pressure which can be measured, which is a proxy of portal venous pressure, which is called as, which is the second definition of portal hypertension. It is a proxy of portal venous pressure, which is called as HVPG. It stands for hepatic venous pressure gradient. Okay, there is a way in which it is measured. We don't need to know that. Wedge hepatic pressure minus free hepatic pressure. Not that important. But yeah, there is a hepatic venous pressure gradient. This is something which can be measured. If this is more than 5 millimeters of mercury, then also you can label someone as portal hypertension. So what is more measurable is HPPG. But what is as per definition is portal venous pressure more than 10 mm of Hg, obviously. But let me tell you, in clinical practice, none of these are used to diagnose portal hypertension. You use clinical markers of portal hypertension, which I will tell you in a bit. So first get these values clear in your mind. When will I label someone as having portal hypertension by definition? Now come to the pathogenesis. This is the most interesting part. That why are we so worried? Like, we are worried about pulmonary artery hypertension because if there is too much of a resistance in the pulmonary arteries, it puts strain on your right ventricle. You get right heart failure, right? That is one way. If I have systemic hypertension, there is left ventricular hypertrophy, there is left heart failure. So those arterial hypertensions affect the heart. How is a portal venous hypertension affecting? Like if there is too much of a congestion in this circulation because of some obstruction, what's the big deal? The vein will dilate. No, it's not going to explode. So what's the big deal? This is what I want you to understand in a very simple way. That what happens when I say portal hypertension and why is it such an important disease to understand. So let's go back to where we started with the anatomy, that you have the splenic vein, which is coming from the spleen. It is draining the spleen. Then you have the superior mesenteric vein, which is coming from the intestines. They come together, they form the main portal vein. This main portal vein will split into left and right. It will enter the liver, go into multiple branches. Now these branches supply the liver. They do the detoxification of the blood. So the hepatocytes will detoxify, they will produce albumin, clotting factors, all that thing function will happen in the liver. And then this blood, once it is detoxified, is going to enter the 3 hepatic veins. So the drainage of the liver is by what are called as hepatic veins. Okay, so there are the 3 of those hepatic veins, right, middle, and left. So these 3 hepatic veins will eventually empty into the IVC, the inferior vena cava, IVC. And then it will take the blood to the right heart. So this is the basic blood flow. Now, when I say portal hypertension, anywhere in this pathway, either at the level of the liver or at the level of the main portal vein or at the distal part in the hepatic veins or the IVC, anywhere in this pathway, there should be an obstruction. So for me to get a portal hypertension, the first thing is there should be an obstruction to portal blood flow. So this is the portal flow, which is starting in the portal vein, entering the liver, hepatic veins, IVC. So there should be an obstruction to portal flow. This can happen for various reasons. The easiest and the most common reason that you should know is what is called as cirrhosis of liver. In cirrhosis,